Thank you, Mr. President, for your recognition, and I rise today with my colleagues from the Senate Committee on Indian Affairs, Senators Heitkamp and Senator Cortez Masto, to talk about how the Republicans' latest and most heartless health care bill hurts American Indians and Alaska Natives. I've just heard some good news that this bill might not be brought up for a vote this week, but Republicans insist that they will continue their efforts to repeal the Affordable Care Act and raid the Medicaid expansion program, which will devastate Indian country. So this latest withdrawal is great, but they're saying it's not going away, and so we have to maintain vigilance on this issue. We came together before in July when Republicans' Better Care Reconciliation Act threatened to roll back health care for Native communities. With that bill's defeat, we hope the debate over legislation that jeopardized health care for Native communities was behind us, and we hope we could begin to work in earnest in a bipartisan way to address the real health care problems that Americans face. Given this new threat, my Indian Affairs Committee colleagues and I must remind this chamber once again that the federal government bears a solemn trust and treaty responsibility and obligation to ensure that Native Americans receive quality health care. Each version of Republican repeal we have seen so far violates that trust responsibility by taking health care away from hundreds of thousands of Native Americans and abdicating the federal government's Native health care responsibilities. If any of these proposals pass, Native Americans' health and lives will be endangered. These efforts must be stopped. Everyone familiar with Indian country knows that the Indian Health Service is severely underfunded. Don't get sick after June was a familiar refrain on many reservations, pueblos, and villages. Limited funding meant medical services were often rationed to only emergency care or life and limb. IHS patients were not guaranteed access to comprehensive medical services, specialized services, or preventive care. The Affordable Care Act and the Medicaid expansion changed this equation and changed it dramatically. The ACA alone has increased third-party billing revenues to IHS more than 25%. And Medicaid funding for IHS has increased nearly 50%. Tribal and urban health facilities have been able to move away from health care rationing. Medicaid expansion has provided health insurance to an additional 290,000 Native Americans from 492 tribes, almost 90% of all tribes. This includes 45,600 tribal members from my home state of New Mexico. Uninsured rates in Indian country have decreased from 53% to 39%. And many tribal communities' uninsured rates are even lower. At the Santo Domingo Pueblo in New Mexico, 22% of Kiowa Pueblo Health Corporation's patients were uninsured in 2013. In 2016, the uninsured rate was down to 7%. At the Santa Fe IHS service unit in New Mexico, 84% of our patients now have some sort of insurance. On the Turtle Mountain Reservation in North Dakota, they've seen a 14% reduction in uninsured tribal members. At the Portland Urban Indian Health Center, the rate of uninsured has gone from 56% to 8%, solely due to Medicaid expansion. This is impressive. Let me just say that again, gone from 56% uninsured to 8%. Medicaid expansion has helped make up for this historic underfunding in IHS services. Third-party billing revenue through Medicaid now makes up to 35% of the Kiowa Pueblos Health Corporation's total budget. For the Hickory Apache tribe in New Mexico, Medicaid makes up more than 75% of their third-party billing revenue. And at Navajo Crown Point IHS Hospital, 50% of their budget comes from Medicaid third-party billing revenue. For Seattle's Urban Indian Health Clinic, operated by the Seattle Indian Health Board, Medicaid and Medicare expansion have resulted in a revenue increase of 146% since 2012. And Medicaid expansion has allowed IHS to expand services and build new facilities. Kiowa Pueblo Health Corporation has used some of its third-party billing to offer new specialty care services like obstetrics and podiatry and to build new clinic space. Santa Fe IHS used its additional funds to build new examination rooms for Santa Clara Pueblo, establish a mobile health unit for San Felipe Pueblo, and update outpatient rooms at the main clinic in Santa Fe. The Seattle Urban Indian Clinic uses its additional revenue to expand patient services to include a pilot opioid addiction program. In the words of the National Council on Urban Indian Health, Medicaid expansion has been an unqualified success. The ACA brought new hope to Native families and communities. But this latest Republican plan will undo this success. Thank goodness it's been withdrawn. In that plan, they claim that they will preserve Medicaid expansion eligibility rules for tribes. This offers a false hope. Like most people on Medicaid, tribal members go on and off the rolls as their income fluctuates. Proposals like Graham Cassidy would require that they be continuously enrolled in Medicaid expansion and work to receive benefits. If not, they will be dropped permanently from the program. Section 128 of Graham Cassidy is also being pushed as helpful to Indian country. This section expands IHS's federal reimbursement rate to non-Native providers. But really, it is a veiled attempt to buy off state leaders concerned about massive cuts to the Medicaid program. It will not improve healthcare tribal facilities, it will undercut the IHS, and it will undermine the tribal self-determination by bypassing tribal input in the federal Medicaid reimbursement process. And there are 30,000 Native Americans who now have private individual health insurance thanks to the ACA. Every Republican plan so far strips away the ACA's cost-sharing subsidies and tax credits that help make private insurance affordable for many of these tribal members and for millions of working Americans. The Republican bill does nothing to help these Native Americans keep their health insurance. The sponsors can try to dress this bill up, but the glaring reality is that Trump Care 2 would be terrible for Indian country. In fact, it is worse for tribes than any other proposed repeal plan so far. It's no surprise that prominent Native organizations, the National Indian Health Board, the National Congress of American Indians, and the National Council on Urban Indian Health oppose Graham Cassidy and proposals like it. They join virtually all major patient advocate and medical organizations in their opposition, including the American Heart Association, American Cancer Society, American Lung Association, and the American Medical Association. 80% of the American people disapprove of the Republicans' attempts to undermine health care. Graham Cassidy is woefully out of touch with the American people and especially with Indian country. I'm glad this bill won't receive a vote this week. Mr. President, just like tens of millions of our fellow Americans, tribes, tribal organizations, and individual Native Americans all around the country are worried what Republicans will do to their health care. I received a record 15,000 calls, emails, and letters from constituents about health care this year. Almost all of them have been opposed to the Republicans' relentless attacks on health care. And not a single tribe has reached out to my office in support of this bill. These attacks are happening behind closed doors. There was only one rushed hearing, and it was yesterday. There is no formal Congressional Budget Office analysis, and there has been no meaningful consultation with tribes. Although many of us have called for that, there has been no consultation. It is difficult to adequately describe the recklessness, cruelty, and cynicism in the Republicans' rush to tear down the ACA. The Senate Health, Education, Labor, and Pension Committee started a bipartisan effort to address the real health care needs in this country, but Republicans froze it once Graham Cassidy was introduced. And I'm really hoping now that Chairman Lamar Alexander and Vice Chairman Patty Murray can get back to the bipartisan work that needs to be done. Other time-sensitive legislation with broad bipartisan support, like reauthorization of the Children's Health Insurance Program and the Special Diabetes Program for Indians, which need to be enacted before the end of September, were pushed aside. Congress needs to change focus. We need to work across the aisle to meet the needs of the American people. And we need to improve Native American health care. We have come a long way under the Affordable Care Act and the Medicaid expansion, but we are far from being able to declare victory. I echo our colleague from Arizona, Senator McCain. Given the enormous impact of health care on the lives of Americans and our economy, we need to find bipartisan solutions through the regular order. Partisan repeal of the ACA is not right for Indian country or for America. And now, Mr. President, I would yield the floor to my colleague from North Dakota, Senator Heitkamp. I worked many years as Attorney General with Senator Heitkamp. She was a great champion during those years for Native Americans and specifically for Native American children. And she's been an incredible advocate on the Affordable Care Act and the good that it has done for Native Americans. So, Senator Heitkamp.